Hello everyone, this is Suprabha. Welcome back to another session with me. In today's session, we will be discussing about dengue. So basically, dengue is a viral disease and it is one of the most rapidly spreading mosquito-borne disease, right? So mosquito-borne disease means that it spreads through, mosquito. And if we look at the prevalence, then it has high prevalence, right? Among children also, it has high prevalence. Well, next let us move on to etiology of dengue, right? So I mentioned earlier that it's a viral disease, right? So it's basically the name of the virus is actually dengue virus, right? So we have four distinct serotype of dengue virus, which we call it as dengue virus 1, that is dengue 1 to 4, right? So the family of this virus is Flaviviridae and it's a single-stranded RNA virus. Now all of these four serotypes, that is dengue virus 1, 2, 3 and 4, all of these causes dengue in a person, right? But among all these four virus, dengue virus 2 and dengue virus 3 causes severe disease. Well, next let us see what is the vector of this disease, right? So it's transmitted by infected Aedes mosquitoes, right? So this is very important. You have to remember that, which mosquito actually causes dengue, right? So it's transmitted by infected Aedes mosquitoes. Well, next moving on to the host of the disease, right? So the primary host of this virus is actually human. And if we see, the severity of the disease, this depends upon several factors like gender, whether they have any secondary infection, or their age, or if they have any, chronic diseases. In all those cases, it will be more severe. Well, so we understood what is the vector of this virus and what is the host, right? Now, next let us move on to pathophysiology. So, we already know that this infection is spreaded through, infected Aedes mosquitoes, right? So, once the mosquito bites, the mosquito is carrying the virus. So, once the mosquito bites, the virus enters enters into the human body and the virus gets fused with the host cell. So basically it's getting attached with the host cell and it's entering into the host cell, right? So basically due to its structure, it has certain structures with the help of that, it gets attached or it gets fused with the host cell, and that helps the virus to enter the host cell. So now we have the virus which is actually fused with the host cell, right? So it has already entered the host cell. Now once it has entered the host cell, what happens? The virus becomes disassembled into a viral RNA. So now we have the viral RNA right outside the host cell, and this is so that means the viral RNA is exposed, right? So once the viral RNA is exposed, it would start to replicate. So now what is happening, that the viral RNA is replicating, right? So the replication is taking place. Now once there is enough replication, or once there is increased number of replication, what would happen? The virus would again start to assemble, right? So what we learned, what we saw, that the virus would enter into the human body and it would get fused with the host cell, right? So it would enter into the host cell, and then once it enters into the host cell, it would start to disassemble, right? So after disassembling, we would get a viral RNA which would be exposed, right? Which would be present outside the host cell. And this viral RNA would start to replicate, right? Now again, when we have enough replication, this, the virus would start to assemble again. So now the virus mature to a virion, and then it gets packaged again and it can be released to infect the other cells. So now the virus is again released, right? Now it has undergone all the process, all the changes, and now it has become matured. It has become a matured virion, and this virus would infect the white blood cells and the regional lymph nodes. So it would also start to infect the lymphatic tissues. Alright, so that is how the dengue virus infects the host cell. Right, now next let us move on to incubation period. So what is the incubation period of dengue virus? Now this is about 3 to 14 days. Well, next we will be talking about signs and symptoms. Right, so there would be several signs and symptoms in adults, but more the children are more likely to be asymptomatic. So if you see dengue in children, then they would not have much of symptoms. Most of the time it is asymptomatic. However, there will be certain symptoms, so which again based on the risk factors, and the severity also. Right, so next we would move on to the phases of the infection to learn at which phase what kind of infections or what kind of signs and symptoms that we can see. Right, so basically we have 3 phases. Now the first phase is called as febrile phase. So this is a phase where the symptoms start to begin. Right, so the symptoms usually begin at day 4 to 7, and this phase, that is febrile phase, lasts for 3 to 7 days. Right, now from the name itself, febrile phase, right, it's very much clear that the child will have fever. Right, at this phase it's there would be fever, and that's why it's called as febrile phase. Right, so there will be fever, and what kind of fever will be there? It will be of sudden onset, and also the fever will be high grade fever, and sometimes in young children we can see febrile seizures. Well, apart from fever, the child will also have dehydration. It can also cause neurological disturbances, and there will be headache, also retroorbital pain. So retroorbital pain is a very it's very common signs of dengue. Also there might be myalgia, arthralgias, or sometimes nausea, vomiting, diarrhea, and abdominal pain. Now, all these signs and symptoms actually depends upon the severity of the disease, right? So definitely if the child is having, myalgias, arthralgias, and continuous nausea, vomiting, and abdominal pain, or diarrhea, this indicates that, it's definitely a severe case of dengue. Now, apart from all these symptoms, there are also some other signs and symptoms which are very rare. But again, if it is a very severe case, in that case only we can see all these signs and symptoms. For example, there might be lymphadenopathy, there might be maculopapular rash, hepatomegaly, also some sort of respiratory symptoms like cough, nasal congestion, and sore throat. And the child might have leukopenia and thrombocytopenia. Right, so these are the symptoms which are not that much common. Again, it depends upon the severity. So if it's a very severe case of dengue, then we can see any of these symptoms. Well, next, moving on to the critical phase. Right, now this critical phase is also not that common. It doesn't happen for, or it doesn't occur for every patient. Right, so if it's a very severe case, then again this phase might occur, but it's not common in every patient. Right, so it occurs in very small subset of patients, and it's more likely to occur when there is already a secondary infection, or the person is having any existing medical conditions. Right, so again the risk factors, like if there is any risk factors like existing medical conditions, or there is secondary infection, in all those cases only we can see that there will be a critical phase. Well, this phase lasts for 24 to 48 hours, and here what we can see is that there will be thrombocytopenia, and this thrombocytopenia can be very severe. Right, so you can understand when there is severe thrombocytopenia, what are the what is the symptom that we can see. So definitely there will be bleeding. Right, now this bleeding can cause hematochezia, melena, or hematemesis, or epistaxis. Right, So as a nurse, it is very important for you to know that, what is the signs, or what is the indication that you may get when the child is in critical phase of dengue, right? So all these things you have to assess. If there is bleeding from nose, there is blood in the stool, right? There is dark stool. So all these indicates that the child might be having a critical phase of dengue. Now, when there is bleeding, right, when the severe thrombocytopenia would result in bleeding, that is called as dengue hemorrhagic fever, right? So you can remember from the term dengue hemorrhagic fever, right? So hemorrhagic means there will be bleeding, right? And when there will be bleeding, when there is severe thrombocytopenia, right? So if the child is having severe thrombocytopenia, and because of this, there's bleeding, and you can see, hematochezia, melena, or hematemesis or epistaxis, this indicates that this is dengue hemorrhagic fever. And then this can also lead to vascular leakage, right? So because of this plasma leakage, what would happen? There would be shock, and this shock would eventually lead to organ impairment, right? So there might be acute kidney injury or liver failure, or the central nervous system also would get involved, right? So this is known as dengue shock syndrome, right? So here, because there is a massive plasma leakage, and that is why there will be shock, right? And this shock leads to organ impairment. So this is known as dengue shock syndrome. So now you can understand that there are three severities of dengue fever, right? So the first one is dengue fever, which is a normal phase, which is not that severe. So the child would have very minimal symptoms, and most of the time the child would be asymptomatic, right? The second thing is dengue hemorrhagic fever, which is again severe than normal dengue fever. So here we would see bleeding, right, because of severe thrombocytopenia. So this is the second thing, that is dengue hemorrhagic fever. And then again, third, we have dengue shock syndrome, right? So here, because of the massive plasma leakage, there will be shock, and this shock would lead to organ impairment, right? So the kidney might get involved, or there might be liver failure, or the CNS also might get involved, right? So this is what is called as dengue shock syndrome. So we basically have three severities of dengue, we can say, that is dengue fever, dengue hemorrhagic fever, and then dengue shock syndrome. Next, moving on to the recovery phase. This is the third phase where everything would start to get resolved, right? So there would be resolution of vascular permeability, right? And also the hemorrhagic risk would start to decrease. The vital signs would also stabilize, and sometimes we can see that there would be eruption of new rashes. Like when we learned about the febrile phase, we learned that there would be maculopapular rashes, right? Right now, this rashes, which would be, which a person would be getting during the recovery phase, is very much similar to the rashes which occurs in febrile phase, right? So there would be eruption of new rashes, and the person might have chronic fatigue. Well, next, moving on to diagnosis of dengue, right? So to diagnose dengue fever, we can do serology. In that, we can find if there is anti-dengue IgM antibody, and this can be found out by the day 4 of infection, right? So this can be done, and this would confirm the diagnosis of dengue fever. Well, next, moving on to the treatment, right? So in treatment, again, we don't have any specific treatment for this viral disease. We have supportive treatment, right? So we would do supportive treatment, and there's no specific medications, right? So symptomatic and supportive treatment will be given. So the child might be given with mild analgesics, and also we have to make sure that we focus on oral rehydration, right? So there will be dehydration. So to correct that, we have to focus on oral rehydration. Also to treat acidosis, we can give sodium bicarbonate. One more thing which you have to remember, that you have to avoid aspirin, NSAIDs or corticosteroids, and also ibuprofen, right? Or aspirin containing products. So we already know that the child would be having thrombocytopenia, or there would be risk of thrombocytopenia, right? Always. So for that we have to avoid these substances. Next important aspect of treatment is fluid management, right? So in fluid management, again, we would give IV fluids to the patient. So whoever is having nausea, vomiting, continuous, there's ongoing plasma leakage. So for that, we would give IV fluids. And patients who have internal and internal bleeding is there, or GI bleeding is there, for them we have to give blood transfusion, right? So this is how we would do fluid management. Well, next, moving on to the nursing management, right? So in nursing management, first we would discuss about nursing assessment. So in nursing assessment, our first important thing would be collecting history, right? So we have to collect history that about date of onset of fever. So from when the child is having fever, and also the symptoms and the severity, right? So for each symptoms, you should know that how severe the symptoms are. So next we have to ask about the hydration status of the child. So we have to know that how much fluid intake is there, right? Since the child is having fever, and from that time how much fluid intake is there, and again how much urine output is there, right? What is the frequency, what is the volume, and what is the time of most recent voiding, right? So these are the things that we have to collect history. And then we should also know, whether the child is having fatigue or myalgia or not, right? Whether the child is able to get up from the bed and is able to do his daily activities or not, right? Now, apart from these things, we also should know that there is, whether there is any other way through which the child is losing fluid, right? For example, if there is diarrhea or vomiting, that means, apart from urine output also, the child is losing fluid, right? So that we have to know to plan our fluid management, right? Next, if there is any warning signs, so for that you have to make sure that you ask or you collect history about all these symptoms, and you have to understand if there is any warning signs. For example, if there is any severe kind of symptoms, and then if there is any family member or who has traveled to a dengue endemic area, that also could be a cause. So that also we have to know. And next thing would be whether there is any risk factors present, right? So definitely if you have an infant, for them it is, the risk will be again more, right? So these things we have to collect history about, and we should also know that if there is any other existing medical conditions. So the first step, we have collected history, and now with the second step, we would check the mental status of the child. Also, we would check the hydration status of the child, and if there is any bleeding manifestations, like bleeding from mucosa, or if there is dark stools, or bleeding blood in the vomit, and also if the child is having epistaxis, right? So these bleeding manifestations also should be checked. And then if there is abdominal tenderness or liver enlargement, and if there is fluid accumulation, right? So for example, if there is pleural effusion or ascites, so these are the things that we have to check. We have to check in our assessment period. And then if there is any other important signs, like the child might have maculopapular rashes, so these rashes, or if there is tachypnea, or if there is difficulty breathing, right? Also, along with these things, we have to assess their intake output chart, which is very important to manage the dehydration, right? So this is what we would do in our assessment. Now next, moving on to the nursing diagnosis, right? So at this stage we have to formulate the nursing diagnosis. So definitely the first thing would be risk for bleeding related to possible impaired liver function, right? So we know that there would be there would be thrombocytopenia, right? And there might be severe thrombocytopenia. So if there is thrombocytopenia, definitely the child will have risk for bleeding, right? So this is the first thing that there would be risk for bleeding related to possible impaired liver function. Again, next could be deficient fluid volume related to vascular leakage, right? So we know that there would be vascular leakage, there would be massive plasma leakage, and that would lead to shock, and eventually that would cause certain organ impairment, right? And this is what is called as dengue shock syndrome, right? So when there is this vascular leakage, definitely there would be deficient fluid volume, right? Now, apart from this, there might be risk for infective tissue perfusion related to failure of the circulatory system, right? So these are some of the nursing diagnoses. Now next, let us move on to nursing interventions. So in nursing intervention, what we would do, we would do a continuous blood pressure monitoring, right? So some children might have risk for risk for low blood pressure, right? Hypotension or hypertension. So however it is the condition is, based on that we would do a continuous blood pressure monitoring. Also, we have to monitor their pain level, right? Now the child might have abdominal tenderness, and sometimes based on the severity of the disease, this pain might be diffused, this pain might be or might be localized, or it might increase in nature, or whether it's decreasing. All these things we have to note. So we basically have to note the characteristics of the pain, and we have to monitor the pain level. Next, we have to maintain their vascular access. So this is very important because fluid management is very important, right? So we have to provide a continuous fluid replacement therapy, right? Because the child might go for dehydration, so we don't want that. And to avoid that, we have to maintain this vascular access, right? So to do that, definitely we have to maintain a patency of vascular access, right? Because we have to provide fluid replacement, we have to give fluid administration, and also we have to give blood replacement, right? So for that, this is very important. So we have to maintain the vascular access. Next, we have to maintain the hydration in the patient, right? So again, we have to maintain their IO chart, and we have to make sure that the child is not dehydrated, right? So we are providing enough fluid for the child. And next, if the child is having risk for bleeding, we have to manage that also, right? So again, for example, if the child is having epistaxis, right, which is bleeding from nose, so we can apply ice bag, and also we have to maintain the position of the child. So definitely we as a nurse, it's your responsibility to take care of the bleeding also, because the child would be having risk for bleeding. Next, we'll be providing comfortable position to the child. So here, comfortable position means we would give Trendelenburg position, because this position would help to restore blood volume to the head, right? So that's why we would provide Trendelenburg position. And next would be educating the family members of the child, or educating the parents of the child, right? So we have to educate them on the use of mosquito nets and insecticides, right? So it's very important that they do not keep anything uncovered, like stagnant water should not be there near the home, or they should always use mosquito nets, because that's very safe for the child, right? So you have to educate the parents about that. You have to educate the parents like how this disease is transmitted, right? So that's how you have to educate the parents or the family members. And you also have to advise the parents that they should provide a diet to the child which is rich in vitamin K, right? So again, because after dengue, the child will have less platelets, right? There would be thrombocytopenia. So definitely to recover from that, we have to provide an adequate nutrition to the child. And adequate nutrition means here food rich in vitamin K. Well, so that's all about today's class. So let us conclude our today's topic here. So today we learned about dengue fever, which is caused by dengue virus, where we have four different serotypes, dengue 1 to dengue 4. And dengue 2 and dengue 3 is the most, they cause the most severe form of dengue. We also learned that, there are three severities of dengue, which is dengue fever, dengue hemorrhagic fever, and dengue shock syndrome, right? We also learned how to manage this disease, or what, as a nurse, what is our responsibility, right, in taking care of a child with dengue. So I hope you have got a better insight about the topic. Thank you.